Hey everyone, I'm Brittany Skyler and today is Tuesday, August 6th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. The Children's Hospital at Montefiore was recently awarded the prestigious Emergency Nurses Association Lantern Award. The award recognizes an emergency department that demonstrates exceptional performance in leadership, practice, education, advocacy, and research. AVP for the Emergency Service Line at Montefiore Health System, Dr. Janine Llamzon, joins me to discuss. Doctor, thank you so much for joining us today.
Hi, Brittany. Good morning.
Good morning. So let's get into this amazing award that the CHAM Emergency Department received. You guys are the recipient of the Lantern Award. Tell us a little bit about it.
So the Lantern Award is one of the most prestigious awards for emergency departments in our country and actually internationally. And many emergency departments apply for that award, and we are the first in the Bronx. So I'm truly, truly proud for this recognition.
Congratulations. That is so amazing. I mean, when I was reading over your bio, I saw so many amazing things that this emergency department does, and I'm so excited to get into all of it. But, tell me a little bit about how did it feel to have your efforts recognized?
So I remember I was sitting in a room, and it was a Zoom meeting with the president of the Emergency Nurses Association. And I was really, really anxious. Together with my senior vice presidents, they opened the Zoom call and they told us right away that you won the Lantern Award. And what I felt in that moment is not just succeeding a personal dream, but actually like recognizing that the Bronx deserves this. And the partnership we had with the community of the Bronx speaks volumes that we need to provide the excellent care that these patients in the Bronx deserves.
That is so wonderful to hear. Tell us a little bit about how it is to serve underserved communities here in the Bronx and being able to provide that adequate care that sometimes people may feel like they won't get in a place like the Bronx.
So what I appreciate most about Montefiore Einstein is that we have become leaders in care, because 80% of the needs of the patient is not about just medical care. It is really having an informed decision about tackling very, very difficult problems such as food insecurity, housing problems. And we in the Children's Hospital and Montefiore as a whole, we make sure that those are a part of our care. Every single patient that come in Montefiore, we have community workers, we have social workers that actually look at the needs of the patients. And our care does not stop in the hospital. Our care transitions even in the community. And so we are very, very proud of that.
I think that's such an exceptional way to distinguish yourself from other emergency departments, not just here in the borough, but in the city overall. Tell me a little bit about how the Children's Hospital works to maintain that.
I think we have a strong connection with our community. Our leadership team also involves our government relations. We also have community workers. We have transitions of care and community ties and strong relationship with the leaders in the community so that we can hear from them. In the Children's Hospital, we also have committees that actually involve the families and their patients so that we can hear from them. We can feel what their needs are. And when we hear them, we can partner with them in creating innovative changes and pathways so that we can provide them not only the best medical care, but a holistic care that they deserve.
Of course. And the Children's Hospital, it works so hard to provide all this care. Well, what are some of the challenges of working in an underserved community?
Talking about the emergency department, we are one of the busiest emergency departments in the country. And we have a high volume of patients. And like I said, there are a lot of socio-economic needs of our patients. But I think in learning and listening from the patients and the families in the community, we made it a priority to partner with them so that they can also help us determine what are their priorities in care. In our emergency department, we make sure that within 10 minutes, a nurse sees the patient. and the nurse has pathways to speak with the providers so that whomever is in high risk need. So one of our projects, which is the sickle cell disease, if the patient is in pain and if a patient needs help right away, we tap our doctors right away and you get specialized care in the moment. And then even if you're coming in for some lower acute needs, we also have a pathway for that. Because even if you do not have an emergent need, we need to be able to see you right away too.
Yeah. You know, this was the perfect segue because I was going to speak about how the Children's Hospital tackles complex illnesses like sickle cell. So tell me a little bit about, number one, the severity of the disease, because I feel like that's something that not a lot of people are aware of. And then also, you know, how the team works to support families and the patients affected by these complex diseases.
So 1 out of 365 Black babies have sickle cell disease. And patients with sickle cell disease, they can be affected in many ways. Their heart can be affected, their vasculature can be affected, and they can be in extreme pain. And so one of the ways that we have innovated in our emergency department in partnership with our frontline staff, our nurses were actually the ones who created this innovation. The moment that a patient comes in with sickle cell crisis, they are seen by the nurse right away. We call our doctors right away so that the patient can be given pain medication if they need it. And then we call our specialized care. And specialized care doesn't necessarily mean just the doctor. We also have community workers so that when the patient transitions to the community, they can still have the help that they need. We also have personnel that will help with play, because when you're in pain, you don't just need pain medication. We need to give you adjunct therapies to help you with, you know, alleviating the pain by distraction. So we have coloring and games in the emergency department so that they can still remain as children even through their crisis. So that's I think what's excellent about our children's hospital and our emergency department.
Absolutely. You know, I don't have children, but I do remember, you know, being in the emergency room sometimes as a kid. And it's already hard enough for the parent, you know, trying to figure out what's wrong with their child. But also as a child, you don't necessarily understand the long wait or everything that's really going on. So how does the Children's Hospital really work to ensure that families are informed and educated on what's going on?
So one of our nurses, his name is Ben Quinones. One of his projects was creating a patient experience card. Because like you said, our families told us, sometimes we don't know we're waiting. 1 hour can be a long time when you're just sitting in a busy emergency department and you see people walking by and you feel like you're alone.
Yeah.
So what we decided through this project of one of our nurses was to communicate with the patient and have a patient experience card that tells you exactly what you are waiting for and prompts the nurses and our physicians to go over there and sit next to the patient and their family or their guardian to remind them and to tell them and to update them of what's going on in their care.
I think that's such an amazing resource and tool to use. And earlier you had spoken about, you know, you have coloring and different activities for the children. So that way, you know, they remain children in this whole process. But something that I want to talk about, which when I saw, I was so, you know, just warmed to see, was the Teddy Bear Hospital.
Oh, I knew you were going to say the Teddy Bear Clinic. It's my favorite project.
Tell me about it.
Okay, so once a year, we have a community party. And so we set up a mock hospital. So it's a play hospital. And then our nurses are there. The kids bring in their teddy bears. And if they don't have a teddy bear, we supply it for them. And they come in, oh, my teddy bear has a fever. And so we do an x-ray, we do a play IV insertion, and we also do all of the things that you may expect when you're coming into a hospital. And what's great about it, Brittany, is that they get to experience to be a caregiver of their family member. And so that our hope is that when they come to the hospital, they remember that play experience so that there is no reason for you to be anxious, that you have nurses and physicians who actually care for you, who will be with you in that process. So that is something that I'm truly, truly proud of, not only because it's a great project, because it's the staff who actually thought about it. And that's who will be taking care of your family members when you come to Montefiore.
I think that's amazing, and it just emphasizes the heart that you have to work in healthcare, and I think this is just such a beautiful project that goes along with that. Tell me, what has been the feedback and the reception been like from patients and their families?
I think it just told us that after receiving the Lantern Award, it made us believe that there is so much more we can do in this community, and that they've helped us be an excellent emergency department because of the feedback they've given us. And now it's just the next frontier for our other emergency departments. This is a role model. CHAM Emergency Department has become a role model for all our other emergency departments. And we're so excited for this new adventure for us.
That's amazing. And just to wrap up quickly, tell us a little bit about the support that CHAM requires to sustain itself, and how can the community get involved?
The support that we need from the community is just continue to tell us. We send you surveys, tell us what we need to improve. And also we work with a lot of community resources, and they channel and they funnel it back to us in our patient and family communities. And so continue to be honest, continue to tell us your feedback, because I promise you, we have physician, nurses, and administrators like me who will listen to you and will provide you with like a humble and a modest way of changing everything that we can do to provide the care for our patients.
Dr. Llamzon, I want to once again congratulate you and the entire team, and thank you so much for joining us today.
Thank you, Brittany, and I am happy to show you what we've done in the Children's Hospital, and I'm excited to see you when most of our emergency departments get the lantern.
Absolutely. So to learn more about the Children's Hospital at Montefiore, please visit their website at cham.org. Don't go away, we'll be back with more Open right after this.